In this video, we'll demonstrate the procedure for the enzyme-linked immunosorbent assay, or ELISA. The ELISA we'll do in the lab is an indirect ELISA, which is used to detect the presence of antigen-specific antibodies in a sample. We'll be testing unknown samples to determine if the samples contain antibodies to the antigen bovine serum albumin, or BSA. Please carefully follow the instructions in LabTutor for details regarding the volumes and incubation times for each reagent. In the lab, you'll test 4 unknown samples for the presence of anti-BSA antibodies, plus positive and negative control samples. The ELISA is performed in plastic microwells. These wells have been pre-coated overnight with the antigen BSA. The antigen binds to the bottom and sides of the plastic wells. Label the strip of wells to indicate which sample will be tested in each well. Between each of the incubation steps, you'll use a squirt bottle to wash excess reagents from the wells. You'll first wash with PBS Tween and then PBS, according to the LabTutor directions. After each wash, empty the liquid solution remaining in the wells by inverting the strip over the sink, and then gently tap the wells onto a paper towel to remove any excess liquid. The first reagent to be used in the assay is gelatin, which blocks any sites on the plastic that are not bound with antigen. To do this, you'll add gelatin solution to each well and then incubate the wells at room temperature. After the incubation with gelatin and washing, it's time to add the samples to the wells. The positive control contains primary anti-BSA antibodies, and the negative control does not. The unknown samples may or may not contain anti-BSA antibodies, and you'll determine which of these unknown samples are positive or negative. After incubating the samples and washing the wells, you'll next add secondary antibodies to each well. The secondary antibodies are conjugated to the enzyme horseradish peroxidase. The final reagent is ABTS, which is the chromogenic substrate for the enzyme. After addition of ABTS, set the well strip on a piece of white paper for 10 or 15 minutes for the results to develop. Negative samples will be pale green, which is the color of the ABTS solution. In positive samples, the enzyme will convert the ABTS to a darker color green. You'll compare your results to the positive and negative controls. Which of these unknown samples shown here are positive for anti-BSA antibodies? If you have any questions about this procedure, be sure to ask your instructor for guidance during the lab.